Spring savings are in the air and at Ross, where they have savings on all the brands you love. From the latest fashion to outdoor decor and even pet supplies, savings are in every aisle. Go to Ross and save 20 to 60% off other retailers' prices on your favorite spring finds.
Some things work better together, like NARS's Soft Matte Complete Concealer and Radiant Creamy Concealer. Soft Matte Complete Concealer erases and blurs imperfections with full coverage. Then, Radiant Creamy Concealer evens and brightens with a luxurious texture and radiant finish. 2 concealers, 1 flawless look. Perfect for a no-foundation base. NARS, better together. Visit Ulta to shop now.
When I worked in the emergency room, I always thought it was strange that parents would come to the ER for something like pinworms or lice, because there are over-the-counter treatments and you don't actually need to see a doctor. Plus, they're not really emergencies. I mean, I'd rather go to the pharmacy than wait in a waiting room. Although, as a parent myself, I can 100% understand how parasites on your child's body could feel like an emergency. And you may want the comforting voice of a doctor to reassure you that it's going to be okay. You can treat it, it'll go away. I got a lot of other questions in the ER that were kind of routine, like questions that most people would ask their regular pediatrician. But as I've said a billion times on this show, the business of medicine has forced us into a position where we have like 10-minute office visits. And in that amount of time, we have to examine you, ask you questions, give a diagnosis and treatment, and write down every single thing we did. It's ridiculous. So today is my chance to tell you what I would tell you if the insurance companies, regulators, and everyone else would mind their business and let me spend time with my patients. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kid's health. I mix the science of medicine with the reality of parenting. Before I get to how to treat the creepy crawlies, here is a question that I am asked surprisingly often during a well baby visit. And my answer is usually, yeah, it's fine. But since I have time right now, here is the answer I would give if you and I were sitting down to coffee and you were kind of a science nerd. So bear with me as I explain all of this, or just skip ahead to the end of the show if you don't want to hear the details. Anyway, here is the question that a dear friend asked me.
Hello, this is Pilar, and I would like to ask you a question. I live in Italy and I have a baby. My husband's family would like to go for the weekend to the Dolomites, but I don't know if I can go. Can I take the baby with me?
I'm asked this question all the time, so I'm glad to now have the opportunity to answer it. Sometimes this is a drive to a high-altitude ski resort, and sometimes it's just a few hours on a plane. And the truth is that for most healthy babies, air travel and even visiting high-altitude destinations can be done safely. There are not a lot of research studies on this, but most of them show that the rate of acute mountain sickness in kids is actually the same as in adults. About 1 in 3 to 4 adults and kids get significant symptoms when they go to altitude. There was only one study I could find of kids that were aged 3 months to 3 years who traveled to above 10,000 feet, and about 1 in 4 kids in the study had acute mountain sickness. And most importantly, the kids who were the sickest and the most likely to get sick had recently had a cold or an upper respiratory infection. So that's one of my tips. Maybe skip a high altitude trip above about 8,000 feet if your baby has recently been sick. The other tricky thing that was learned from these studies is that altitude sickness is harder to recognize in kids. Adults and older kids who can talk say, I have a headache, I feel nauseous or dizzy. But young kids and babies, they're going to have more vague symptoms. That's what the studies show. They have fussiness, they don't want to eat. And of course, when you're traveling, some kids will be like this anyway because their routine changed. So that makes this a really tricky situation. So when I sort something out like this in my head, and I'm trying to give you advice about whether it's safe for you to take your baby to high altitude, I think about the science and what I know about the body and how it works. So let me take you through my thinking. I'm sure you know that air is thin at high altitudes, meaning there's less oxygen. Even on an airplane where the cabin is pressurized, it's like you're standing on a mountain that's about 6,000 to 8,000 feet high, depending on what the cabin altitude is set to by the pilot. Adults usually don't notice much of a difference, but babies, they're not just mini adults. Their lungs, their heart, even the way their brain controls their breathing are still developing. I learned all about this in med school. Babies breathe faster and they need more oxygen for their growing bodies. Most healthy full-term babies can handle a small drop in oxygen just fine, but for babies born early or those who have lung or heart problems, this could cause them to breathe less efficiently, and some babies might even have temporary dips in their oxygen levels, especially when they're asleep, since babies under 6 months old have a less mature system for responding to low oxygen. As I said, growing babies have a higher need for oxygen. In the first years of life, babies are growing really, really fast. Their brains, their muscles, their organs, they're all developing quickly. And this kind of growth needs a lot of energy. And to make energy, every cell in the body needs oxygen, naturally. Since babies are building tissues so fast, they need more oxygen than adults do, about twice as much oxygen per pound of body weight compared to an adult. And that's what we mean when we talk about kids having a higher metabolic rate. Their cells are like little factories working overtime, constantly demanding fresh oxygen to fuel their fast growth. And add to that, babies have smaller lungs and fewer alveoli. Those are the little tiny air sacs that are in their lungs where oxygen gets into the bloodstream, the alveoli. By the time we are adults, we have 300 million alveoli, but newborns start with only 20 to 50 million. So, not only do babies need more oxygen, but they have less surface area in the lungs available to absorb oxygen. How do they meet their high oxygen needs? They breathe faster. That's why it's normal for babies to have a resting breathing rate between 30 and 60 breaths per minute, compared to an adult that breathes around 12 to 20 breaths per minute. One more important thing to know is that babies, especially those that are under 6 months old, don't respond to low oxygen as well as older kids and adults. All of our bodies have little sensors, and they're called chemoreceptors. They're located mainly in the neck, and if you're a nerd, you know these, they're the carotid bodies, and they're also in the brainstem. And these receptors detect oxygen and carbon dioxide in the blood, and they respond. In adults, when oxygen drops, these receptors tell the brain to breathe faster, fast and deep, to bring in more oxygen. And that's why you breathe faster without thinking about it when you're at a higher altitude. In young infants, especially those under 6 months of age, these chemoreceptors are still developing. They're not very finely tuned to respond to low oxygen. In fact, really young infants sometimes don't increase their breathing enough when their oxygen drops, and that's called hypoventilation. Unfortunately, I have a really embarrassing story about this. Okay, here it goes. Our family planned a ski vacation, and a few days before our trip, my husband broke his arm, really badly. Both of the bones in his forearm broke, and they went through the skin. So bad compound fracture. He had surgery, and they put plates in, and me, being the rather driven person I am, insisted that we still go on our ski trip. So we get there, and my husband is taking opioids for pain, and he gets severe altitude sickness because of hypoventilation. That's what I was talking about in babies. The pain medicine he was on blocked his body's natural response to low oxygen that would make most people breathe faster, so he just couldn't get enough oxygen. Anyway, it happened. I'm embarrassed. We got him an oxygen exchanger, and he sat on oxygen the whole week while I had a great ski trip. So like my husband, some babies hypoventilate, and this is particularly true when they're asleep. That's why babies who were born early or kids who had apnea episodes need special attention if they go to an area with lower oxygen during a flight or a trip to a high altitude. Some babies in the NICU are even given caffeine when they are young to help stimulate them to breathe. Another issue is that a baby's rib cage is soft and more flexible, so it makes it harder for them to expand their lungs completely. In adults, our ribs are sturdy and they help keep the lungs expanded open during inhalation. But for babies, their soft, squishy ribcage means that each breath is less efficient. So if we combine immature breathing control with the natural dips in oxygen that happen during sleep, it's easy to see why young babies can be more vulnerable to altitude-related breathing problems when they're flying or visiting a high-altitude destination. So if your baby was born early or had issues with apnea, and that's pauses in breathing, you should be especially careful. Babies like this are at a slightly higher risk of having pauses when exposed to low oxygen levels. So in this case, I would not recommend traveling to a high altitude until after probably a year of age. So when I'm thinking about whether I think it's safe for your baby to travel, I think about their oxygen needs, the size of their lungs, and how immature their breathing control system is. However, most healthy full-term babies can handle the mild hypoxia of air travel or moderate altitudes. But for some babies, especially those who are premature, or if they have heart or lung conditions or a history of apnea, these make it important to talk to your doctor before you travel. So in general, I think it's safe after about 3 to 4 months of age when your baby's body systems that I talked about are all more mature. But I wouldn't go to a high altitude younger than that if you really don't have to. So that's everything you need to know about the lungs and breathing at altitude, but there are a few other things that I know parents worry about. So first, the ears. Everyone who has flown knows that weird feeling or when you're popping your ears during takeoff and landing. It happens because pressure builds up behind the eardrum as the air pressure around you changes. And babies have a shorter and more horizontal ear tube. That's the little passage that helps equalize ear pressure called the eustachian tube. This makes it harder for them to clear the pressure, which can lead to their pain and crying. So it's one of the best tricks I offer. Let your baby breastfeed or bottle feed or suck on a pacifier during takeoff and landing. When they swallow, it helps balance the pressure and makes them more comfortable. Then there's dehydration you need to think about. Plains are dry, mountain air is dry, and because of their small size and high surface area, babies lose water faster than adults, and this can make them fussy or tired. So make sure you give them fluids often, and that can be breast milk or formula or whatever they want. Altitude can also mess with your baby's sleep. So between time zone changes, altered routines, and mild oxygen changes, you might notice your baby is fussier or sleeps less or wakes more often. And this is temporary, but it's helpful to build in some extra downtime during your trip to let everyone adjust. But my friend Pilar asked about, what if you're going to a real ski mountain? Okay, so flying is one thing, but if you're heading to a ski resort above 8,000 feet, that's when we start to see cases of altitude sickness, even in toddlers. So like I said earlier, babies can't tell us if they have headaches, but they may have signs like poor feeding, vomiting, irritability, or unusual sleepiness, and that could mean they're feeling the effects of the high altitude. So if you notice any of these things, it's important to go to a lower altitude and see a doctor. There are rare cases of serious conditions like high altitude pulmonary edema or high altitude cerebral edema that can happen, and those can cause severe neurologic problems or breathing problems. Again, it's rare, but it's why we are cautious. After all of this, I'm not sure any parent would take their child to a high altitude. Why would you take the risk? Although I have to say, our trip was really, really memorable when we went skiing.
Lowe's knows how to help pros save. That's why the new MyLowe's Pro Rewards program lets you unlock exclusive member deals on the things you need every day on the job. Plus, MyLowe's Pro Rewards members can get volume discounts on eligible orders through a quote of $2,000 or more. Join for free today. Lowe's, we help, you save. Exclusions, more terms and restrictions apply. Program subject to terms and conditions. Details at lowes.com/terms. Subject to change.
The spirit of innovation is deeply ingrained in America, and Google is helping Americans innovate in ways both big and small. The Department of Defense is working with Google to help secure America's digital defense systems, from establishing cloud-based zero-trust solutions to deploying the latest AI technology. This is a new era of American innovation. Find out more at g.co/American innovation.
At Capella University, you can learn at your own pace with our FlexPath learning format. Take 1 or 2 courses at a time and complete as many as you can in a 12-week billing session. With FlexPath, you can even finish the bachelor's degree you started in 22 months for $20,000. A different future is closer than you think with Capella University. Learn more at capella.edu. Fastest 25% of students. Cost varies by pace, transfer credits, and other factors. Fees apply.
I need to apologize in advance. I mean, every healthcare worker goes through this, and parents are going to know what I'm talking about. But anytime we think about lice or see a patient with lice, we act calm and act like it's not a big deal, because it really, truly, absolutely is not a big deal. And we know we're not going to get lice from your child, but still, we can't stop feeling like our scalp itches just at the thought of lice. So that's why I'm sorry, but I'm about to talk about lice. Okay, you get a call from school telling you they found head lice on your child. What thoughts go through your head? I know you think, how did she get them? What should I do to get rid of them? Do I need to clean the house really well? How do I prevent her from getting lice again? This is every parent's nightmare, I know, but don't worry, you're not alone. I promise this is one of the most common, annoying, and completely manageable things I talk to parents about. So let's go through your questions one by one. How did your child get lice? Well, lice love kids. Why? Because kids love each other. They hug, they lean their heads together during story time, they share hairbrushes, they whisper secrets, they snap selfies. All the things that make childhood fun also make it easy for lice to spread. They don't jump, fly, or swim. Lice crawl very slowly. The most common way kids get lice is through head-to-head contact with another kid who has lice. And it usually happens at school, camp, daycare, sleepovers, whatever. Less commonly, lice might be picked up by sharing a hat, a hair accessory, or a pillow. But that's actually a lot less common than people think. And listen, getting lice is not about cleanliness. Lice don't care if your child's hair is squeaky clean or hasn't been washed in a week. They just want a nice, warm, cozy scalp and hair to grab onto. What should you do to get rid of them? That's the next question. First, take a deep breath. You can handle this. That's step 1. Take a deep breath. There are 2 main parts to getting rid of lice. First, you need to kill the lice. And second, you need to remove the eggs or nits. Most families start with a lice shampoo like permethrin or pyrethrin. These are safe when they're used as directed, but they don't kill the eggs. That's why you need to do a second treatment about a week later after the remaining eggs hatch. So 7 to 9-ish days later, use the shampoo again. Next, you need to do the old school but very effective method of manually, with your hands, picking out the nits. So after you've done the shampoo, you have to go through the hair section by section with a fine-toothed lice comb and physically remove the nits. It takes patience and some good lighting, but it works very well. I tend to think that the lice combs are not particularly effective and they're hard to use. I think it's better to just pinch the hair with your nails and pull the nit along the hair until it comes off. And again, remember, the second treatment with shampoo is critical because of the life cycle of lice. The nits that you see on the hair are the eggs, and then there are baby lice, which are called nymphs, which is a cute word for a gross thing, and then there are adult lice. And over-the-counter treatments work very well, but they only kill the live lice and not the eggs. So you need to pick off the eggs and maybe treat again in a week to kill any lice that have hatched. So if over-the-counter treatments are not working, your doctor can prescribe a stronger medication that targets more stages of the life cycle. All right, your next question. I know, do you need to clean the house really, really well? Well, the good news is you don't need to burn the house down. Lice don't survive that long off of the human scalp. So once they're away from the warmth and food of your child's head, they die within 1 to 2 days. And the nits also need body heat to hatch. So while it's helpful to do some basic cleaning, you don't need to scrub the entire house with bleach. Here's what I recommend. Wash your sheets, pillowcases, hats, and any recently worn clothing in hot water and dry it on high heat. And then with your stuffed animals and pillows or things that can't go in the washer, put them in a sealed plastic bag for 48 hours. You can vacuum your couch and maybe your car seats too, but there's no need to spray any pesticides around your house. It's totally unnecessary. Last question. How do you prevent your child from getting lice again? Honestly, you really can't lice-proof your child, but you can lower their risk. Teach your child to avoid head-to-head contact, especially during play or sleepovers or taking selfies. Avoid sharing combs, brushes, hats, and hair accessories. And keep your kids' long hair pulled back in a braid or ponytail because it's harder for the lice to latch onto the hair. Some parents do think that using hairsprays or essential oil-based lice repellent sprays work, and there's no strong science behind that, but it's harmless and it might help deter lice from choosing your child's head. The most important thing you need to do is detect this early. So I tell parents to do regular, quick scalp checks, especially during the school year, because the sooner you spot lice, it's easier to deal with them. So the bottom line is that getting lice is just like getting the common cold. It's unpleasant, but it's common and normal. I'm so sorry. It doesn't mean you or your child did anything wrong. And with the right treatment and patience and a lot of combing sessions, you're going to get this under control. So one last thing, if you ever need help deciding which treatment is best, or if you just need someone to walk you through the plan step by step, that's what pediatricians are here for. All right, since I'm already talking about itching, I hope you're not scratching your head too much. I might as well throw this one into this episode too and get it over with. It's pinworms. It's the number one reason your kid's butt is itchy at night. And for girls, it can cause vaginal itching. All right, pinworms. First of all, again, no shame, no panic here. How do you think your child got them? Well, pinworms spread through what we call the fecal oral route. I know that sounds really gross. The tiny pinworm eggs leave an infected person's body through their poop and can end up on hands, under fingernails, on play surfaces, toys, bedding, clothing. The eggs are so small you can't see them. Then kids accidentally swallow these microscopic eggs, often because they put their unwashed hands in their mouth. That's it. It's disgusting. And it happens all the time because kids are kids. They scratch their bottoms when they're itchy. They forget to wash their hands. They share toys and snacks. So don't beat yourself up. This is one of the most common parasitic infections in kids worldwide, and it has nothing to do with poor hygiene or being a dirty kid. It has everything to do with normal kid behavior. So what do you do to get rid of them? Luckily, pinworms are one of the easiest things we treat. So start with medication. Pinworms are treated with an anti-parasitic medication that comes over the counter, or you can get a prescription. But the best one is a medication like Reese's pinworm medication. It's very effective, completely harmless to humans. And the key is that you need to repeat this dose about 2 weeks later to kill any eggs that hatched since the first dose. Otherwise, pinworms can come back. The other really important thing to do is treat the whole family. Since pinworms spread easily within a household thanks to kids sharing bathrooms and parents doing their laundry, it's really easy to just treat everyone at the same time, even if they don't have any symptoms. All right, the next thing, you may need help relieving the itch so your kid will stop scratching his bottom. And that classic symptom of pinworms, the itchy bottom, happens mostly at night. That's because the worms are nocturnal. Yes, they come out at night and lay eggs around your child's anus. A little over-the-counter anti-itch cream and a warm bath can help soothe your child until the medication that they took does its job. Do you know how we diagnose pinworms? Some parents see the worms themselves with their own eyes, and for some kids, we know that's what it is because their bottoms itch so much and only at night. But here's the awesome test. It's called the Scotch tape test, as in the piece of clear tape. You put it on your child's butthole at night and wait and take it off and see if there are worms on the tape. It's awesome. There's also a commercial test kit that we have. It's a little plastic paddle and it's shaped like a swab, and the end of it has sticky tape on it. And we can send that to the lab and see if they have eggs or worms on it, but it's really not that necessary. There's no harm in treating a child if you think they might have pinworms. So that can just be the test, just giving the treatment and see if it works. All right, next question. Do you need to clean the house really well? And my short answer is not as much as you think. Pinworm eggs can survive on surfaces for 2 to 3 weeks. So it is worth doing some extra cleaning, but you don't have to go full Cinderella. Here's what I recommend. Wash bedding, pajamas, underwear, and towels in very hot water. Vacuum your floors, especially in the bedrooms and bathrooms. Wipe down any common touched surfaces like toilet handles or doorknobs. And have everyone in the house trim their nails really short and practice extra good hand washing for a little while. You don't have to bleach everything. The goal is simply to reduce the chance of reinfection. How do you prevent your child from getting pinworms again? It's really about interruption, stopping the tiny eggs from getting back into your child's mouth. So encourage good hand washing, especially after bathroom or before eating. Keep their fingernails trimmed really short so eggs don't hide under their nails. And remind your kids as much as you can not to scratch their booty. That one's tough, but even minimizing their booty scratching can help. Regularly wash their bedding and pajamas, especially while you're doing the treatment. And the reality is, with all of this, some kids do get them again. It's okay, they're annoying, but it's harmless, and they don't cause any long-term health problems. So the bottom line, get it? Pinworms sound scary because they're worms, but they're also really more of a nuisance than any kind of health threat. They don't cause any lasting harm, and with simple medication and some basic hygiene, you're going to kick them to the curb in no time. And remember, you are not alone. Every pediatrician has either treated a family for pinworms, treated their own family for pinworms, or both. And so there you have it. That's your mini lesson in parasitic microbiology and their life cycle. If you looked at your body under a microscope, you would be horrified to see how many microbes live on your body. We actually need them, so just don't think about it. If you have a question that you don't feel like you've gotten a full explanation for, send me a message. We never have enough time in clinic to fully explain this stuff, and I'm happy to do it here. So keep listening. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.